Good afternoon, everyone. Thank you very much for making the time to have a look at evolution today. So we're going to address what was on the agenda for today. So why move to evolution? Right, you should be seeing our first slide there, which is the technology stack slide. We've had a total refresh on the technology stack used for evolution. And this allows us to cater for the ongoing needs of primary healthcare and improve on the technology used in Medtech 32, a good sound platform, but the advantages of today's technology allows us to deliver speed and reliability, security, scalability, interoperability, and much more. We have a significantly enriched functionality, so we've retained what is tried and proven with Medtech 32 and really what is somewhat timeless in the way clinicians and those who use Medtech 32 operate. But we've enriched the usability and the functionality with the ribbon layout. We've added a lot of extra functionality, which you'll see across the top there, Seibert widgets, user workspace, which we'll go over in a little bit of detail today in the demo. The plan can be implemented for automatic backups that really runs like clockwork. Evolution doesn't require a full restore, so significantly less management is required around the maintenance and servicing of evolution. One of the other benefits is our powerful data analysis tool. And we've included this as part of evolution. If you're a Medtech 32 user, you might remember, or you might be using CAT. So this is like CAT on steroids, and it delivers clinical insights in near real time, and it has some enhanced business reporting functionality. So in terms of the total cost of ownership, evolution has a concurrent licensing model, so you only need to license for the peak of your use. No remote licenses are needed. So this, combined with more automated maintenance, reduced clicks, improving productivity, seamless third-party integration, and a technology stack that improves speed and reliability, really makes evolution an excellent choice. And if you're planning for the future, you really need to have tools for the future. So we believe evolution gives you the tools for today with a view to planning for the future. So how different is it? Evolution's been built from the ground up with current and future needs in mind. So it's a Microsoft Office layout with click navigation. That's very important and one of the main features of how you access the information within the practice management system. All core functionality of Medtech 32 has been retained, so all shortcuts and the core features of Medtech 32 are there. The user experience is enhanced. It's information that's gracefully presented. So as well as enhancements, we've got a number of new features designed to streamline the workflow and augment the information available within and to a practice. So let's take a look. Okay, so this is the user workface, the user interface of evolution. You'll probably recognize it if you're an Office user. In 2008, Microsoft actually released Office with the ribbon, which is what we call this across the top here. And the ribbon actually has all these different tabs which hold the contextual menus. So you access the information by just clicking on the relevant tabs. So on this Home tab here, we've got large icons that are clearly labeled. Some of you might be celebrating already compared to the size of the icons in Medtech 32, although you get to know them pretty well. They're also grouped in logical grouping. So if you actually were a Medtech 32 user and you came straight into this application cold, you should be able to intuitively make your way around the application. So it's quite a simplified operation to navigate your way around. It really eradicates the drop-down menus of Medtech 32 and is a lot easier to migrate your way around. So let's have a look at patient registration. We've simplified, we've given it a nice crisp look and feel, and we've enabled you to put in more information on that front tab there. So you've got homework, mobile phone, and email, and also we've put the ethnicities on this front tab. Other changes are in the contacts tab. You can add multiple contacts. You can designate whether they're the employer or a next of kin, and you can allocate a contact as a default contact. You can have as many as you like. In the provider tab, you can also add multiple providers. You can click on the ellipsis button here, which will access the address book. You can search in the address book and just pull in the provider, and it will populate all these fields here. Finally, in the patient register, you can add a photo of your patients. This is quite a good security feature and particularly useful if you're prescribing narcotics. Okay, let's look at the appointment books. So as I said, all shortcuts are retained, and if I click on F7, that will bring up the appointment book. So it's quite a colourful departure from Medtech 32. And if we look here at the day, the week, and the month, you can actually look at a provider's week in advance. But if I just dial back a bit, we've got rid of appointment book 1, 2, 3, and 4. And how you access the appointment books is simply by ticking on the provider here. And if you want to look at multiple providers, it's just a matter of clicking on that provider. We recommend a 24-inch monitor for optimal viewing, and that will deliver you 4 appointment books on the screen at the same time. However, today we'll just stick with Jack Dawson. That's who I've logged in as. We'll work from left to right. We still actually, for those of you who love drop-down menus, give you the Actions menu here, which has a lot of areas you can navigate. However, we give you an icons menu on the top here for those functions that you're using repeatedly and on an ongoing basis. To the right here, we have appointment type. So we give you the ability to categorize your appointments, and that adds a color code. And we hope over time that you'll come to know and recognize those colors very easily, and that'll improve the assimilation of information from the appointment book. We give you the status bar here, and if we look at Robin Cole, for instance, her status, I can arrive her in this dynamic icon. Sorry, she has arrived. She's been in here for 69 minutes, and I can put her into consultation. Now when her consultation's complete, I can click the complete consultation, and you'll see the C comes up as completed. The other feature of the appointment book is you can right-click, and there is also additional functionality. So if you wanted to book a follow-up appointment, you're able to do that by right-clicking. Okay, other administrative features that are useful if you're wanting to do multiple things at the same time, and you have the luxury of a second screen. We have a open user workspace capability, and I'll just minimize that a little bit because we don't have a second screen. My workspace allows you to do a lot more at the same time, so you can multitask even more than you currently are, and it's non-patient specific tasks, so you just drag that over to your second monitor and you can use that workspace as well as having the appointment book or whatever else you need open at the same time. Right, for a busy practice, you've got another additional feature is our status screen. So I'll click on status screen. Now you'll see here we have another ribbon that actually stores the areas that you've been within the practice management system. So that's you don't have all these layers on top of each other like Medtech 32. You're just conveniently storing everything in the different tabs. So if we go to the status screen, what the status screen is a really useful tool for your front desk reception to get an overview of the practice and the patient journey overview. So you can look at when they arrived or what time their appointment was, and in particular if they've paid or if they've been invoiced. So you can see here that Gavin Larson has completed his appointment, he hasn't paid, then he hasn't been invoiced. So those little housekeeping issues throughout the day, you can attend to those so you don't have a big pile of work at the end of the day. Now, if you're navigating your way around and you like looking at multiple things at the same time, we have a new feature called Widget. So if I click on Widget, Widget always opens up the appointment book. I can tuck the calendar side away and I can extend it. And you can have a 2-widget view simply by clicking up here, or we can go back to the 3-widget view. What this enables you to do is actually look at multiple things pertaining to the patient at the same time, and you can utilize that information in your interaction with the patient. All right, we're going to move on to the clinical side of evolution. So we've retained all our shortcuts, but we've combined F6 and F12. So your consultation comes up with your daily record, and the new features of the clinical side of evolution is the navigation pane. You have these menus across the top here, and you can navigate your way around with one click. But we also give you the option of this. This looks very much like an Outlook dashboard. You can also use the functions of your dashboard, and you can navigate your way around using the dashboard. So if I wanted to use the patient record area, I could look at medications, and that would open the medications in what we call the dynamic workspace. And I can simply return to the daily record with one click. A useful feature is, I'll just close out of the widget view for now. A useful feature for the GP is the appointments tab. Now these are the people that are completed and these are pending. So we've got Jason Green who has arrived. We haven't got anyone in consultation at the moment. So if I go back to the appointment book, I can put Jason Green into consultation and his status will change, and I can arrive column and his status will change, and you can see it changing there to green. Now if I wanted to view any of these patients, it's just a double click on them and it will open up the patient manager. Okay, you would have seen a dashboard open at the same time. I've got the BPAC patient prompt dashboard open, so we've incorporated this into the clinical area. You can also open it in other areas, but it's more likely to be used by a GP or a practice nurse. So I'll just tuck that away. The clinician has the option on the right-hand side on the dashboard here to use our clinical dashboard. So I will just open up the patient dashboard, sorry, the clinical dashboard. And we think of this as a news service. It actually delivers information to the GP while they're consulting with the patient, and you'll notice if I hover over there it actually delivers the full view. Now I can still click, if I'm looking at medications, I can still click into the medications tab if I want to. So it really is just one click away, and I can configure this to work for how I work and operate when I'm consulting. So if I want to include different elements, I can just add them to the clinical dashboard. And finally, Seibert, it's our clinical business intelligence tool, and I will just bring someone onto the palette. Oops. I'll just put Robin on the palette because she's got some reasonable conditions, and I'll just move. Okay, so Seibert is actually delivering information to the clinician for the patient on the palette. So for Robin Cole, every night Seibert runs its queries, and we've got over 140 queries, and it delivers those insights to the dashboard and therefore the use of the GP, and they can choose whether or not they take action on the areas that are highlighted. So for instance, the areas that action could be taken are highlighted in orange, and if I hover over, okay, this one's just straight history of diabetes with no lipids recorded in the last 12 months. So, you know, Robin may have come to see her GP about a sore knee, and yet the clinician, although they're focused on the knee, also has these prompts. So it's kind of like an artificial intelligence that actually allows the clinician to take action if they see fit. Alrighty, I'm going to move on now to more practice management functions. Really the big area is that we see is the overall navigation and being able to move around the application. But work list is certainly an area of enhancement that practice managers will welcome. And what it enables the practice manager to do is, instead of using the daybook, they can actually come into this area, and it's just a matter of choosing your provider. So I'm Jack Dawson today, clicking on Chris Clancy, and it brings up all the information in regard to that consultation. So you can see here the financial information. If I click on someone else, let's have a look. I think I've done some clinical things for Sandra. No. Maybe Gavin, we can see there's some clinical details added there. There's some recall information, and the practice manager can review that and check that all the finances have been completed. And if you think back to the status screen, all these little things here can be completed throughout the day and then reviewed at the end of the day by the practice manager or the designated person. Okay, in addition to that, we have our Seibert tool, which is our full-blown tool, which really analyzes the whole database. And every night, and you can set the time you would like it to run, but it makes sense to run it overnight, it runs all the queries and it delivers the information. So if you go into the Seibert tool as I have and say you want to look at your registration management, these are all the queries that the database is returning information on. And if we click on one query, registered patient but not enrolled, we've got 31 patients. We can decide if we want to click on how many are female and how many are male. Looks like the guys are doing better in this instance. We can return back to the default filter. So this really enables you to make the most of opportunities around revenue. And these are really important functions for a practice manager. But not only that, from a clinical perspective, you can look at chronic care and preventative care. And if we look at the PHO, and I know we've got quite a few people from the PHO here, now known as IPIF measurements, if we click on one of those queries, diabetes patients not followed up with an annual review, if I want to download those patients, I can simply click and export to Excel, and it will deliver that list to me. I can configure what is received on that list or what is extracted to the list. So if I want to look at name, address, phone number, I can get all of that information. So it's a very powerful tool, both in a clinical setting, but also from a practice management point of view. Well, thank you very much. That was a whirlwind tour. It concludes our webinar, the demonstration side of it. I've got a couple of other points to cover, so I'll just click back in. For those of you who are interested in how easy it is to implement, we take a phased approach. We have an implementation team. They project manage the whole project. Generally, we convert your data to the new database structure and format, and we do a trial migration in the first instance. You check that, you sign that off, and then we do the full migration, the full conversion and migration, and mostly we would do that on the weekend. So we pull the data on the Friday, and we generally configure for users and practice needs on the Sunday. So on Monday, your team would receive training and go live support, and overall we recommend 3 days to complete this task. Okay, so what are the maintenance costs? There's significant savings due to the more automated database management and upgrade regime. So Medtech also has a diagnostic tool that can run in the background, identify technical issues, and it enables our technical team to respond with necessary actions, and sometimes in advance of the action affecting the PMS. So there's an overall need for less maintenance and servicing required, and it means cost is reduced from that area. So just in summary, the key benefits. As we've spoken of, that we're using the latest technology, we've refreshed the technology stack, we've enriched the functionality and the usability with all those new features. We have an automated maintenance program, more automated backup, not a need for restore, powerful data analysis tools with Seibert, and overall the total cost of ownership with the concurrent licensing and the reduced maintenance being really attractive to future-proof your practice with the tools for tomorrow. Thanks very much for listening and attending today. If you would like to contact us, or if you'd like your own demonstration and perhaps a little bit broader capability overview, you're welcome to contact us on any of those on the phone. You can email us, or if you want to go to our website, you can also request a demo, and there's other actions you can take there.